Hi all, in this class we are going to see one case study, that is implantable Cardioverter Defibrillator in the context of a hypertrophic cardiomyopathy, a lesson in a patient anatomy. So in this case study, I have taken one condition, that is called hypertrophic cardiomyopathy, the patient with abnormal activity of the heart, okay, and the same patient is being recommended to go with the implantable Cardioverter Defibrillator. And what are the discussion on the how the healthcare providers is being how healthcare providers is supporting the patient while taking decision, and how they are very clear about explaining treatment and associated risk factors, everything. Okay, so first we will discuss what is hypertrophic cardiomyopathy, that is HCM. It's a genetic heart condition where you can see the abnormal thickening of the heart muscles. So due to this abnormality, the heart muscle will can't work properly. That means it will not able to contract, do action of contraction and relaxation. So it will disturb overall electrical heart systems. So as a result, it end up with the life-threatening arrhythmias like ventricular fibrillation and ventricular tachycardia. The one recommendation for this type of abnormality, the HCM, is implantable Cardioverter Defibrillators. However, it is very difficult for healthcare providers to convince the patient to go with implantable Cardioverter Defibrillators. The reason is that it is going to be implant that is going to place inside your body, okay, and throughout the life, the patient is going to carry this defibrillator. So there will be so many constraints to take over this type of treatment. So let's see what are the personal consideration of the patient, and what are the medical and ethical consideration we have to be considered when we go with decision taking. Okay, so the case presentation here, I'm going to present a case of one patient of John. Is a 5-year-old man. It's been diagnosed with HCM, and after taking so many results, it's been confirmed that the John carries a gene mutation associated with HCM. So even the John doesn't feel any symptoms related to this. After taking so many testings, been confirmed that the John is being affected with this type of problem. Okay, so John's cardiologist, that the healthcare providers recommended the John to go with the ICD implementation due to the possibility of high risk status. Based on they got information from family history and genetic profile. After hearing this, John is very reluctant, or he is very hesitate to undergo this procedure by considering his psychological factor, which is involved in affecting which is involved to affect in terms of lifestyle limitation, or affecting the overall quality of life. Okay, so next, how these two things is getting balanced. That one is the patient anatomy, that is a patient willingness and their rights, and the next one is the medical recommendation, how it goes in line by in one line. Okay, let's see in detail. So first, the John is we know the John is very reluctant to undergo the ICD implantation by expressing their concern about. They are worrying about once affecting their day-to-day life. Okay, but as a healthcare providers, the doctor's duty is to provide the patient with accurate information about treatment and option and their associated risk and benefits too, right? So the doctor is doing that part by explaining all the medical recommendation, even though the John is not ready to accept this ICD implantation. Okay, so anyway, the ultimate decision of the decision should be go in aligned with John's values, preference, and goals of care. So and in second thing, the medical healthcare providers should also respect patients' beliefs and patients' values. Okay, and also they have to support their decision making, so that they will have some clarity, so that they will have some very good decision. Okay, so for that, the healthcare providers again they have to provide us comprehensive information about the risk and benefits of ICD implementation, and also they should give some alternative management strategies like such as close surveillance with regular cardiac monitoring and risk factor modification. So before taking the decision, the physiological impact and quality of life also we have to think. Okay, in addition to the medical consideration. So because there are so many factors which is being involved like anxiety, depression, device related restriction and impact on daily activities, and relationship should be carefully considered. And so these things, everything should be considered or addressed when John is trying to take a decision making process. Okay, so because this is not something just go whenever there is need we can just place it and remove it. This is something we are going to place inside the body to support their heart function. So we always be conscious about the device, so we will be restrict to do so many things. Okay, so it automatically affects one physiological psychologically and and the quality of life also. So these factors also we have to be considered when taking decision about to go with implantation or not. So as a conclusion, this particular John's case underscores that importance of respecting patient anatomy and engaging in shared decision making when considering ICD therapy for HAM. So the doctors here plays a very big role, not only recommending ICD blindly. They are in position to explain everything in detail, to respect the patient's values and preference and individual circumstance. So they should also support the patient decision making by clarifying all the doubts and everything, and so that the decision so that the approach could be like a patient centric decision. It will align with the goals of patient care and optimize their overall well being. Okay, thank you.